Hello, welcome, 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 welcome. I am so excited that you're here. I'm so thrilled to share this time with you. Today, we're going to be talking about how to relieve your chronic hip and perhaps pelvic pain during pregnancy and again during postpartum. I am Leanne Matullo, and I am a perinatal yoga therapist. And so what does that mean? It means that I work with a range of conditions, a range of chronic conditions when it comes to yoga therapy, but that I have a particular interest and depth of knowledge in the perinatal space, which spans female fertility, preconception, so preparing for pregnancy, pregnancy itself, birth, postpartum, and then very postpartum. So this whole series that we're going to be working through, which is this video that's more exploratory and a bit lesson-based, as well as the two accompanying yoga videos themselves, is really going to be a yoga therapy approach to treatment using physical and also subtle anatomy to help you find some relief from your discomfort, any discomfort that you might be feeling. Okay. So if you are here, it is likely because you feel pain. You feel pain in your pelvis during pregnancy or postpartum. You feel pain in the hip region of the body during pregnancy or postpartum, or potentially both. And very simply, you don't want to feel that anymore. You also may not know what's normal and what's not. And I will say, I'll preface this, that there is such a wide variety of what's normal and what's not, but that it is very, very common to feel some sort of discomfort or dis-ease, not disease, but dis-ease somewhere within the body during pregnancy and postpartum. Perhaps you are feeling pain when you're sleeping. This is something that I hear quite commonly. And so you want to sleep better and you want to be able to move more freely throughout your day. Of course, you're seeking relief, and perhaps you like yoga. You might already have a yoga practice or not. You might have a genuine interest in yoga and yoga therapy. And I also will say that this might be your last resort. You might have been trying lots of different programs and protocols and treatments, but nothing really is seeming to stick or to work for you. What I will say is that yoga therapy isn't you do it once or twice and then it's done. It's really up to you to create a consistency, to create some sort of habit, routine, sacred practice to really work with whatever it is that you're experiencing. And in this space, we're going to be talking about specifically hip and pelvic pain. So what are we going to be doing? What we're going to be covering in this short video is basic anatomy of the pelvis. I think it's really helpful for you to have an understanding of what is happening inside your body and what it looks like, as well as some physical landmarks. We're going to be talking about nerves and attachments of muscles, ligaments, nothing too in-depth, nothing too heady, but just so you have a general understanding and appreciation. We're going to be talking about pain, common diagnoses or lack thereof, which is, I would also say, very common, and it's okay. You don't necessarily need a diagnosis. Physical versus subtle anatomy, one of my favorite things to talk about. And then, of course, our yoga therapy approach for supporting you, for getting this relief, and maybe just starting to take a different perspective on pain overall. So let's start with anatomy. And I'm going to move into the pelvis for a moment. So what we're going to do is look at the bony pelvis. Okay, and so this is what the pelvis looks like. If you're on Instagram, you might have seen that I did a little bit of a tutorial on this and in one of the stories that we did. So this is a female pelvis, and I don't expect you to necessarily know everything about it, but I want you to know what basically it looks like. Okay, and it sits right down below the navel, okay, in the pelvic region of the body, and some landmarks that you might want to take a look at. So you have the ASIS points. Okay, so those would be your hip points that are located. If I move my sweater, you can probably find them on the front of the body. Some people, they might be a little bit bonier and easier to access. And some of us, they may not, and that's fine. You might have to press in a little bit deeper, but those are the ASIS points. All right. And then you have the pubic bone. You can see this here, and it runs right along the front of the pelvis in the body. And so the pubic bone is not actually a bone, it's a bit of cartilage. And that's going to be really important for us as we move into more of this conversation. Then if we were to kind of flip this and you were looking at the bottom of the pelvis, These points right here, okay, I can even flip it back, would be the ischial tuberosities, all right? So right in the back here. And so what those are the sit bones. So if you've been practicing yoga, a lot of times teachers will tell you to find your sit bones. That's what we're actually looking at, is the bones that we're sitting on, the bones of the pelvis. And if you want, even right now, you could start to rock from side to side a little bit to find them. They're going to be easier to find on a hard surface, okay? And then if we were to flip this around a bit, okay, so here's your spine there. Here's some of the wings of the pelvis. The other piece that I really want you to be aware of is the sacrum. So the sacrum is right here, okay, right here. And it's kind of this upside down triangle shape. And it is lower than the low back. So low back would be more up here if we were looking at the back body. Sacrum's going to be a little bit lower. It's known as the sacred bone, okay, in Latin. So if we were to look at that, and also yoga really takes this very seriously as being a root of the body. Here's the tailbone. It's quite movable, the coccyx. And the other thing that I want to point out on the back of the body is these points right here, okay? You can see that they're connected to the sacrum. It's where the two sides of the pelvis, so the wings of the pelvis, we'll call them here, are connected to the sacrum. And you'll see that there's actually a bit of movement. You see that in this space, okay? I love working with a pelvis. So you'll see that there's movement. Sacroiliac joints. So a lot of us notice, especially those who have had some yogic practices in the past or lots of movement practices, notice some sacroiliac pain right along here, okay? And you'll notice that's because there's a bit of movement there. So there are some landmarks. Now, the other thing that I want to also bring your awareness to is the pelvis itself. So here is, or the inlet outlet of the pelvis itself. So this would be the inlet if we were looking down into the pelvis. It's kind of got this beautiful heart shape right here. And if we were to turn the pelvis towards the side, I'm going to bring my baby in, okay? This is where the baby would sit. So if we're almost to term pregnancy, we have a bigger baby, they would sit right down here and eventually move a little bit deeper into the pelvis itself. And what you can see from that is there's a lot of pressure, right? A lot of pressure that sits right on top of that pelvis. That's where the baby would be. And as as birth, labor moves on, the baby would descend more into the pelvis for a vaginal delivery and eventually would move out of the outlet of the pelvis, which is framed by those ischial tuberosities. Okay, so the idea of that is so that you know where the baby sits in the pelvic bowl, especially during pregnancy. And this is, of course, interesting for postpartum as well, because there's a bit of weight that's being put on the pelvis. And you're like, of course, obviously, but this will help when we talk a little bit about an attachment and the nerves. So the other thing that happens when we're talking about the pelvis, right? We're not perfectly straight up and down. Okay. So when we're standing, we're not perfectly straight up and down, because what you'll see, or the pelvis isn't perfectly straight up and down, is that the tailbone kind of tucks under. And that's something that we don't want. We don't want to necessarily tuck our tailbones. And what might happen is that we actually dip a little too much. This is a bit of an exaggeration, where the belly becomes heavy, or the core muscles don't necessarily have as much strength if we're in postpartum. And so the belly will tip forward and the pelvis will kind of tip in this way. And that can also put some strain on the low back, the hips, et cetera, et cetera. So the big thing here is that the posture changes, the gait changes during pregnancy and postpartum. And you could even find this on your own body. So I'm going to come into a kneeling position, and you may not be able to see my head, but that's fine. And if we were to turn to the side here, what I want you to think about is you might actually be tucking the tailbone, right? And like lifting the low belly up, and we're shortening all kinds of muscles in the front of the body. And that would be trying to get this more level pelvis, or you might actually be flaring, which is what a lot of us do. Again, this is an exaggeration, where we're really sticking out the pelvis because the belly becomes a much heavier, right, during pregnancy. And then we also may not have necessarily the same core muscles during our postpartum. So that's a bit of anatomy in terms of the pelvis itself and what's happening within your body. And the other big piece of this is that the pelvis is quite mobile. So you'll see that it's not this like super static bone and series of bones. There's 3 bones of the pelvis, that it moves. And this is really going to be supportive during labor and during birth, but it can also be really uncomfortable, which can be a source of the pain during pregnancy and during postpartum itself. So I have a cheat sheet here. There's a couple other things that I want to talk about before we go back to our slides. And a big thing with this is that there is a hormone called relaxin that is moving through the body, circulating through the body during pregnancy and then during postpartum, particularly if you are breastfeeding or if you are pumping, that this hormone stays with you. And relaxin, very simply, it relaxes the muscles, the ligaments, the joints in preparation for birth, and then it stays circulating in your system postpartum. The problem is it's not necessarily just localized in the pelvis, it's all in the body. It circulates all in the body, but it definitely causes that more malleability of the pelvis. Okay, you can see why that might be problematic. If we have that much mobility, where's the support? Okay, maybe even the pubis symphysis moves along the front. You can see that, yeah? So relaxin does that. It makes you more flexible, which I don't want to say can make you more prone to injury, because I don't necessarily believe in setting ourselves up that way, but it is a reason that we might be experiencing more pain and more discomfort. So very important to know. And along those lines, during pregnancy and during postpartum, we want to be moving at 70%, maybe 75% of our capacity, especially in yoga practice, especially with stretching, because of relaxin. So we might think that we might have more flexibility, that we might have more mobility, but it's actually the hormone, and that overstretching can cause problems later. It can cause aches, pains, discomfort, more instability in the pelvis, and it can certainly cause problems postpartum. So you don't want to be moving very deeply into warrior twos, very deeply into squats. You want to be doing those things, but you want to be doing it at 70 to 75% of your capacity. And we'll talk about that in the videos themselves. So another thing to note, I don't know why I keep putting my pelvis down, because I look at my notes and I want to talk about more. So another thing to note is that there are a lot of nerve roots in the pelvis. So the nerves that run all throughout the body, a lot of nerve roots are going to be in the pelvis, okay? So if we have a baby here that's kind of sitting, and you'll imagine its legs are tucked, that's sitting here putting a lot of pressure, maybe even moving through the pelvis, as you can see that, there's going to be a lot of pressure on the nerve roots themselves. And sometimes baby's head or arm or fist, or maybe feet to babies in a breech position, can hit one of those nerves and can cause some chronic pain and some chronic discomfort. And not only that, but there are tons of muscles that attach into the pelvis itself. So there's a lot going on here. So for example, the psoas wraps around to the back of the body and then connects into the pelvis itself. So you might have heard of the psoas muscle. It's that fight or flight muscle. So in moments of stress, the psoas kind of seizes and tightens in preparation for preparing to fight, to run, and then it also kind of freezes up, and that can be a cause of discomfort in the pelvis itself. I don't expect you to remember all of this. I don't expect you to be like, oh yes, this is exactly the source of my problems. But it's really important to be aware of what is happening in our body, what it looks like, and that there is genuinely a lot happening in the pelvis. Regardless of whether there's a baby in there or not, there's a lot happening in the pelvis in terms of nerve connections, in terms of attachments of muscles, ligaments, and joints. And of course, if there's a baby sitting on top of that space, there's even more pressure, and you have the hormone relaxin that's circulating. If you are past breastfeeding, if you are past those first, months or so of the immediate and primary postpartum, and you're still having hip pain, it's not necessarily due to relaxin itself. And we'll continue to talk about that. So if you need to take a moment and pause this and maybe jot down some notes, I totally recommend that you do that. And if not, we'll continue on. Okay, so that was our little anatomy lesson. Now, let's talk really briefly about the sensations of pain, okay? So pain can feel chronic, it can feel dull, meaning that and chronic. So it's happening, I don't want to say all the time, but you're noticing it. You're noticing this pattern pretty regularly. It can be a more chronic, sharp pain that comes when you move into different shapes. And when I say different shapes, I don't mean necessarily just yoga postures, okay? I mean that you might be like getting out of your car or getting out of bed or, moving in a certain direction. You kind of know that's going to be a trigger. That's when that pain always comes, and that's where it's chronic. And then it can also be chronic pressure, chronic achiness that you constantly feel. One of the things that's really interesting to think about, okay, is that there are no pain receptors in the body. And you might be like, wait, that doesn't make any sense. Like, why is it that when I touch something hot, like I feel pain? You have your nerves, okay? And then you have your neurons, and the neurons are what sense for pain. And then they send that message back up towards the brain saying, hey, this is painful. And this is really important when we talk about subtle anatomy, when we get into that, because what we're doing is we're starting to learn how to influence the neurons and their perception of pain. This doesn't mean that pain doesn't exist or that it's completely in your mind. You definitely feel it. You definitely feel it somewhere within your body, but we can also influence how we experience pain, which, if you are pregnant, is something to really consider and think about as you move into your later part of your pregnancy and into your birth and your labor experience. Now, what I want to make perfectly clear is that I am not talking about round ligament pain. Okay. So round ligament pain is not going to be necessarily your pelvis or your hips. It's going to be more in the low belly where the round ligaments attach to the uterus. And that's going to feel more like a stitch. So it's like if you were to quickly run, to try and catch a bus, or if you're, what like a stitch in your side feels like, right? It's going to feel more like that, where there's a quick movement. You kind of get like that pulling sensation or that stitch kind of feeling, but you could probably take a few deep breaths, have some rest, and that discomfort will go away. Okay. So that's not necessarily something that we're talking about. Round ligament is different than pelvic and hip pain, although I hear commonly, oh, you must have round ligament pain, when that is actually not the thing that you were experiencing. Okay. Common diagnoses of pain. So one of them that I see a lot, and I actually think is probably underdiagnosed, is symphysis pubis dysfunction. And that is on the front of your pelvis. Okay, there's that symphysis pubis. It's where the bones start to pull away from each other. Okay, they start to pull away from the symphysis, or the pubic bone. Those two bones start to pull away from each other. All right. Or they might kind of twist or move and become a little bit more mobile. And it causes a lot of discomfort in the front of the pelvis. That's caused by the hormone relaxin. So you might feel it when you get in and out of the car, when you get out of bed, when you're trying to put on pants. You want to keep your knees and your legs together and moving together as much as possible for symphysis pubis. Another diagnosis is kind of a funny word, lightning crotch, quote unquote. And it's when the baby gets heavier and you're kind of walking around and moving, and you kind of literally feel like these like bolts of lightning or sharp pain sensations that kind of move right up either the center of your pelvis or somewhere in your pelvis. And that is usually when baby's getting heavier and starting to drop more into the pelvis. It typically happens in the later part of pregnancy. And it's a good thing. They're putting pressure on different nerves within the body. Good thing, meaning they're dropping. Sciatic nerve pain. This is also something that I hear quite common as a diagnosis, even if it's not necessarily sciatic. So sciatic nerve pain is with the sciatic nerve, and it'll typically feel like a radiating pain, sometimes a shooting pain that moves across the hips or the buttocks, and oftentimes it'll move down into the legs, but it's a pretty radiating pain, okay? Joint instability, I'm going to jump for a second. A big thing would be that sacroiliac joint discomfort. So there's those two spaces along the back on either side of the sacrum. You might feel pain there. Okay. And those spaces, again, might be caused by relaxin, overmobility, not enough strength. There's so many things here, but there could be quite a bit of discomfort. And then it might just be overall achiness, tenderness, soreness attributed to pregnancy. Now, I said this before, just because there isn't a diagnosis doesn't mean that there's not necessarily pain. You also don't need a diagnosis necessarily to be working with pain, unless if this is whatever you're experiencing is beyond your ability to function. And, that's really for you to interpret what that means, that threshold is going to be different for everybody. You really need to seek the help of a care provider, whether that's a doctor or a midwife. Maybe later on, it's an acupuncturist, a chiropractor, a yoga therapist, a physical therapist, whatever that might be. We want to make sure that you are coping well, that you're not suffering, that you're coping well. So those are just a couple of common diagnoses, and there's more, but you might scan down that list and are like, this is what I'm feeling, this is what I'm feeling, this is what I'm feeling. And all of these things would be in the realm of quote unquote normal during pregnancy, but that doesn't mean that we have to always experience that discomfort, okay? So the yoga therapy approach looks at, yes, this is physical. This is happening on a physical level. It's happening in your body. Your nerves are experiencing pressure. Your muscles are experiencing achiness. Your hips feel really unstable. It's definitely physical. And yoga therapy also works on the more subtle planes, the more subtle levels known as the koshas. Okay, so the koshas are these layers that we have in our bodies, and they span many. And so we work on the physical to support the pain, but we also work on the energetic and supporting the breath. Okay. The breath can really help to influence how we interpret pain in our bodies. It can alleviate pain. It can help to rewire the neural pathways that are happening in our brains so that our perception of pain starts to become a little bit different. And it can also very much ease the muscles, the fascia, the joints, all of this to move it into a more relaxed state and to a more restorative state so that we can kind of, if we're like this all the time, we can start to find more ease. Yeah. The koshas, as we work in yoga therapy, also support our mental emotional spaces, which can greatly influence the way we feel in our physical body. And it also is going to be an exploration of our intuition, of moving into our intuitive instincts. Yes. And recognizing if we're trusting them or if we're not. And if any of this is of interest to you, the physical, as well as all these other pieces that we're talking about, we dive further into all of this in the Afterglow Perinatal Mentorship, which I completely encourage you to learn more about if you find that interesting. So in the following 2 yoga practice videos, we're going to use movement to support the hips and mobility, in flexibility and strength. So it's not all about opening the hips or strengthening the hips or doing a bunch of squats. No, we want to make sure that we're doing mobility, flexibility, and strength to support this area of the body. We're going to really bring the breath to turn on the relaxation response in the nervous system, what I was just talking about. We're going to rewire some neural pathways and soothe those tense muscles. Now, the rewiring is going to be really up to you because you're going to have to show up consistently for these practices, not just do them once or twice. Okay, maybe twice a week, 3 times a week, and really take this with you for a period of time. Okay, a month, 6 weeks, 8 weeks, and so on. And we're also really going to be inviting in even more subtle anatomy by working with the element of water. So I am also an Ayurvedic practitioner. It influences my yoga therapy practice quite a bit. Ayurveda is the science of life. It's brought from not the same lineage, but it's in the Vedic scriptures, just as yoga is. And so one of the pieces of this is that the element of water sits in and sits over top of the pelvic region, now the hip region of the body. And this means that this region of the body is also responsible for our sense of flow, fluidity, creativity, and so on in our lives. These different areas of the body, they influence different pieces of our lives. It's not purely physical. And so we're going to be playing with that in our practice as well, in both of our practices. So it is time for practice. It is time to start to dive into those. And as you move through the practices, I also want you to think about these questions. So maybe do a practice and then come back to these journaling prompts, thinking about what am I resisting or maybe fearful of during my pregnancy and or my postpartum. This is all related to pain, okay? What do I need to let go of in order to invite more space for rest and for nourishment? And am I flowing with my life or am I forcing it? And this goes for pregnancy and postpartum. So as you can see, with this approach, we are going to be addressing the physical pain with movement and this experience with breath, but we're also going to be digging into more mental, emotional, intuitive spaces to address pain at every level. Okay, and really help you to feel more stability, a more sense of ease in the hips and in the pelvis itself. So now it is time for practice. I'm so excited to have you move through these practices, move through these experiences. I would love to hear how they go for you. You can always write to me. You can always send me a direct message on Instagram. And if you are ever interested in learning more about Afterglow, please contact me to schedule a session to chat. It's completely free. We take 20 minutes to talk about your needs. There's zero pressure to join Afterglow. I want this to be really an empowered decision from you. And so you can always write to me with questions about Afterglow or about these videos at leanne@leannemotulo.com, or you can click on this link to schedule a call via Calendly. So enjoy these practices. Again, I hope that you take them with you. They're meant to be practiced more than once, but over and over and over again. And both practices and both videos are safe for prenatal and for postpartum. So thank you so much. And I hope that you have a wonderful, wonderful rest of your day.